As an example of the price reductions we have secured through these new agreements, Santa Fe will cut the cost of its blood thinner, Plavix, from $750 to less than $16. Wow. Where's Santa Fe? Where are you? What? That's incredible, huh? Could have gone to $17, maybe. That's amazing. And you're going to do tremendous business. You're going to do much more business. So that's coming from $750, think of that, $750. And that's the number one blood thinner. I don't want to know about that. I take an aspirin. To less than $16, think of that. Bristol-Myers Squibb, great company, both great companies, will cut the price of HIV medication, Rayurtaz, from nearly $1,500, $1,500 to $217. And it will cut the cost of hepatitis B medication, Baraclude, from $1,400 to $413. Gilead will cut the hepatitis C medication, Epclusa, from nearly $25,000 to less than $2,500. And all prices are like that because we're bringing them down to the world's lowest price, everything. And these people really are pioneers. What they're doing is so great. And in the end, they're going to do much more business, and it's, I think it's going to even out for them as a company. The countries will have to pay more, but even for them, because of the fact that the world is quite a bit bigger, it won't be very severe, I hope. I also want to thank these companies and their incredible executives for their generous contribution to American national security, because it's really what it is. It's, to a large extent, national security in addition. You can't continue to pay 13, 14 times more than other countries and think you're going to have security. Collectively, they will invest over $150 billion to build up domestic pharmaceutical manufacturing in America. They're going to be, because of tariffs, they're coming in, and I think because of the love of our country, and maybe because of the November 5th election, but because of tariffs, they're going to be coming in. They're building already. Just about all of them have started. They're building their plants in all states all over the country, and they're building incredible pharmaceutical plants. We're going to have close to 100% of our pharmaceuticals in a very short period of time made in the USA. As part of these agreements, Merck will also donate 3.5 tons of antibacterials to be placed in America's strategic reserve. Thank you very much. GSX will donate over 200 pounds of ingredients to make rescue inhalers, which is a big deal, and Bristol-Myers Squibb will donate 6.5 tons of blood thinners. We appreciate it. Such amazing companies. Every president for a generation has promised to reduce drug prices, but they were talking about a little bit like that. I am the only one of them to ever even think in terms of favored nations, and that's what this is. Favored nations. It's called most favored nation. We are now a most favored nation. I want to thank the leaders in the room, and I also want to thank the leaders of all of the countries that had to pay a little more so that we were treated fairly. I really do. I want to thank the leaders of countries. And they knew the alternative was not much of an alternative, because if they didn't do it, we were going to charge them tariffs, and the tariffs would have been much more severe than what they did. But they did do it as soon as they realized about the tariffs. Then they did it very easily.